Okay, I'm going to show you how to check a blood sugar using the OneTouch Ultra Mini glucometer. OneTouch makes other ones as well, and they all work the same way. I'm also going to be demonstrating the use of the OneTouch Delica lancing device. OneTouch makes other lancing devices as well, but this is the best one. So the first thing that you would do is you would take an alcohol prep pad and clean the finger that you're going to check. And the best place to check a blood sugar is not too close to the cuticle, but on the side of the finger. Either the outside or the inside, never on the pad of the finger. So the first thing you do is just wipe the finger with alcohol to keep it clean. And what you're going to need in addition to these two devices is you're going to need a test strip. And what we're going to be doing is we're going to be using the lancing device to puncture the skin and drop a little drop of blood that's going to be analyzed with the meter by putting the blood on this little test strip. Now these OneTouch test strips have two sides, one with a little gold channel, and that's where the blood's going to go, and the other end is a black and white, looks like a little circuit board of sorts, and that actually goes into the end of the glucometer, and you can tell if it's engaged if once you put it in, the numbers come up, and then you see a number that says C25, which is the type of test strip, and then you will see a little icon for a drop of blood that's blinking. Now I'll warn you now, if you put this test strip in and then wait too long before you administer the blood, what ends up happening is the meter will time out. And if you've forgotten and not paid attention that it has timed out and you put the blood on there, it's not going to read a blood sugar, and you can't take the test strip out and put it back in and have it read that. The blood has to actually go into the channel of the test strip while this icon is blinking. So for the purposes of this demonstration, I'm going to just pull it out so it doesn't time out. If it were to happen where it timed out, what you'd need to do is you'd need to get a new test strip, put it back in, and get some more blood to test. So now that my finger is clean, I'm going to show you this OneTouch Delica lancing device. And there's three parts you need to pay attention to. The first is this wheel at the end. It's almost always set to the number 1. That's how deep the needle will go when it punctures the skin. And what that refers to is there's a little needle here on the end, and when the button is pressed, it jabs into the finger and then pulls back out. And the depth refers to how deep the needle goes in. For a kid's finger, it should always be on number 1. And all you're really going to do is you're going to pull this little lever back till you hear that click. And you're going to hold the device like this and have your thumb over the button, but don't press the button until you actually want to test the blood sugar. The little hole on the end of the lancing device you'll put on the spot where you want to puncture. And then you'll press the button and you'll hear it depress. And then what you do is you kind of milk the finger like this by massaging the finger down towards where you actually punctured it, and sure enough you will see a drop of blood come out. Now the drop of blood needs to be about that big. Not too big, but not too small. I'm now going to actually put this test strip in here. And we wait. You have to wait until you see that blood icon. Okay, this is the tricky part. You never want to scoop the blood or try and force the blood in there or shove it in there because it's not going to work. What you need to do is you need to take the glucometer and kind of put it sort of vertically and then just gently place it against the finger, and then you're going to slide it towards the blood, and the blood is actually going to get sucked down in there and fill up that channel. If you don't have a big enough drop of blood, what's going to happen is it's going to give you like an error. It's going to say like E5. And that means that there's not enough blood on there. So you have to make sure to get a big enough drop. And after the blood is analyzed, you will see a number. And right now my blood glucose reading is 111. And that is how you would check a blood sugar. Usually when you're done, you kind of wipe off the spot to kind of clean it. And that's how you do it.